I really think that every patient who has a complex problem, and I think a brain tumor would qualify as a complex problem, should get at least 2 or 3 opinions. When your value is the interests of the patient come first, providing a second opinion is never a wrong answer.
The value of the second opinion is that it allows you to, number one, understand a little bit better what disease you have, what alternatives you have, and what potential therapies you can implement. The second thing that allows you to be more educated about the choices that you have. And I think that's an amazing value.
Another reason to seek a second opinion is treatment plans do vary. Sometimes patients may be told that a tumor can't be taken out, but very often when patients come here and they've been told that they can't have surgery, the experience of the surgeons here will change to say, yes, surgery is possible and it's safe because of the experience and the technology.
We have found in many cases that with minimally invasive techniques, alternative surgical techniques, and individualized brain mapping, that we can in some cases find a way to get to the tumor safely. Awake mapping and awake surgery can often help with that.
Seeking specialized care, there's really no set of instructions or criteria for that. You could argue, even if you feel that your care is optimized at your local institution, many patients whom I see at Mayo Clinic, they are very happy with their physicians. They're coming to us really to see, look, if one day the other shoe drops and the treatments that I'm getting is no longer working, what would you have available to me? Or they just want to do a reality check. Very often we totally agree with the treatment that the physician team is doing back home, but that corroboration, that reassurance is quite important to the patient.
Coming to Mayo Clinic brings a lot of specialties together. So if you come to Mayo Clinic for a second opinion and you have a brain cancer, what happens is your outside image is loaded up onto our system, and board-certified CAQ-trained neuroradiologists will look at your image. We'll look at your images from the outside, just like you are a Mayo Clinic patient that was coming here to have your surgery. So all these things that triage the direction of your care, which is going to lead to the best outcome, some of that is invisible to the patient, and it happens when they come for a second opinion, when they maybe had surgery elsewhere and they send their tissue here. Maybe they've gotten images elsewhere and they want to say, can you look at my images? Would it be of benefit for me to even come to have this visit because we're so far away from most places? All of that, I think, is beneficial.
So yes, as a patient, question the diagnosis, seek a second opinion, make sure that you have a very good understanding of what choices you have in the healthcare system to be able to take better care of your health.